PolyHeal Micro is a medical device designed to provide the necessary conditions to reactivate the healing process in chronic and hard-to-heal wounds. Two outcomes can be expected after its application: complete closure in wounds with an appropriate wound bed preparation, or formation of granulation tissue, especially in wounds with exposed bone and/or tendon, or with partial presence of slough, in order to achieve closure either by secondary intention or skin graft. PolyHeal Micro is indicated in the treatment of chronic and hard-to-heal wounds that have failed to respond to previous treatments, including wounds with exposed bone or tendon, diabetic foot ulcers, venous and arterial ulcers, pressure ulcers, acute post-traumatic and post-surgical wounds. The use of PolyHeal Micro requires a proper evaluation of the wound prior to the application of the product in order to ensure its maximum efficacy. It is important to guarantee the absence of wound infection before applying PolyHeal Micro. Some wounds may present high bacterial load levels or signs of biofilm formation. PolyHeal Micro is not indicated in highly exudative wounds, since exudate acts as a mechanical barrier between the wound bed and the microspheres. It is recommended to use the product in wounds with moderate to low level of exudate. Exudate level should be managed by treating the local infection, controlling bacterial load. It is very important that the product makes direct contact with the wound bed to promote its mechanism of action. Debridement should be performed to favor the removal of devitalized tissues, particularly when the product is applied for the first time. This debridement should be maintained sequentially at least weekly until all devitalized tissue has been removed. Once the wound has been debrided, saline solution should be enough to clean it up before the application of PolyHeal Micro. Remember that PolyHeal Micro does not replace the standard of care for chronic wounds, and it should always be combined with any required measure according to wound etiology. Steps in the application of PolyHeal Micro. Wash the wound and the surrounding area with saline solution. Dry the wound. Shake the bottle. Apply PolyHeal Micro in drops slowly to the wound surface in order to moisten the wound bed and wound edges. When applying PolyHeal Micro, the wound should be facing up in order to prevent product spillage. Wait approximately 20 seconds for the product to be absorbed. Cover the entire wound surface, including edges, with a non-absorbent gauze. Saturate the gauze with PolyHeal Micro. Bandage the wound using standard dressings that will keep the primary dressing in place. Do not use adhesive or absorbent tapes. If a compression bandage is required, such as the one used in venous ulcers, it should be placed over the conventional bandage. PolyHeal Micro should not be used with ointments, creams, and oily products. Due to its easy application, treatment with PolyHeal Micro can be continued at home under the periodic supervision of a healthcare professional. The product can be applied by the patient itself or a trained caregiver. It is important to be aware of any clinical signs of possible wound infection. If such signs do appear, the treatment should be discontinued and the patient should visit immediately the healthcare professional who recommended the use of the product. It is advisable to wait a minimum of 2 weeks to perform an evaluation of the wound in relation to the formation of granulation tissue. The recommended length of treatment of PolyHeal Micro ranges from 4 to 6 weeks. However, large or deep wounds may require longer treatment periods. Treatment should be continued as long as the wound improves or as long as granulation tissue is present within the wound bed and/or the wound size reduces.